Chapter 4, the shoulders, chest, and back. The subclavius, attaching medially to the first costal cartilage and laterally to the clavicle. Use your thumb to glide along the subclavius just inferior to the clavicle. Do this several times. In clients with a hairy chest, use a little more lubricant. The redness on the skin is hyperemia from the technique. This technique can also be performed with your fingers with the client sitting. The pectoralis major, attaching medially to the clavicle, sternum, and ribs, laterally to the humerus. Grasp the edge of the pectoralis major between the thumb and fingers. Squeeze and wait for a release. Move down the muscle, looking for tender points, working each area as you go. To strip the pectoralis major, use your fingertips to glide medially along the muscle fibers. When you finish your first stroke, start in the same location, but glide more inferiorly this time. Work the entire muscle in a fan pattern. To compress the muscle, start at the lower edge of the pectoralis major and use your fingers to compress. Wait for a release and move up the muscle, searching for sensitive spots. When working on women, work around the breast tissue through the sheet. The pectoralis minor, attaching inferiorly to the ribs and superiorly to the coracoid process of the scapula. To strip the muscle, start laterally to the pectoralis major and superior to the nipple. Place your fingertips on the rib cage and push medially until you feel the pectoralis minor. Gently glide up the muscle. Now release your hand and repeat the procedure, starting more superiorly this time. You can also treat this muscle in a side-lying position. With the client's arm overhead, use your thumb to glide up the muscle. Glide all the way up into the attachment at the coracoid process. Be aware of the sensitive brachial plexus that lie in the armpit. Another side posture option is to stand behind the client and use your fingers. Place your fingers on the rib cage. Push into the inferior portion of the pectoralis minor. Wait for a release. Next, move superiorly and repeat. Keep exploring each level of the muscle. Work all the way up the muscle to its attachment at the coracoid process. Another option for compression is to use your thumbs when the client is supine and work into the muscle that way. To work the muscle with the client seated, stand behind the client and reach your hand under their arm next to the rib cage. Work underneath the pectoralis major to find the pectoralis minor. Once you find it, apply pressure and wait for a release. After the area has softened, move superiorly and apply pressure into the muscle. Keep moving up, turning the fingers to face more superiorly as you go, working on each part of the muscle. The levator scapula. Attaching superiorly to the upper 4 cervical vertebrae and inferiorly to the superior angle of the scapula. To strip this muscle, stand at the head and use your thumb to glide from the cervical vertebrae inferiorly to the scapula. This can also be performed by standing at the side and using your thumb to glide from the superior angle up towards the vertebrae. The rhomboid major and minor. Attaching medially to the spinous process and laterally to the scapula. Use your fingertips to glide from the spine to the scapula. Move down and repeat. You can also use your thumbs. Place one hand under the shoulder and use your fingers to apply pressure into the rhomboids while you lift the shoulder off the table. Work down the rhomboids as you lift the shoulder. You can also do this in a seated position. One hand pushes back on the shoulder while the fingers of the other hand slide under the scapula. On large clients this is difficult, so only use this on smaller clients. Notice the hyperemia in the skin from the previous work. The latissimus dorsi, attaching inferiorly to the vertebrae, sacrum, and ilium, and superiorly to the medial aspect of the humerus. Use the palm of your hand to glide from the top of the muscle inferiorly. Work in a fan-shaped pattern until you've covered the entire muscle. This can also be done with the fists. This can also be done with the fingers. To compress the muscle, grasp the muscle between the fingers and thumb, apply pressure, and wait for a release. Once the tissue has softened, move down and repeat. This technique can also be performed in side posture and make special care to address a common trigger point in the lower part of the bundle here. The teres major, attaching medially to the scapula and laterally to the medial aspect of the bicipital groove of the humerus. Find the inferior angle of the scapula and squeeze between your fingers and thumb. Work laterally out the muscle as you release each point. To strip the muscle, find the inferior angle of the scapula and use your thumb to glide along the muscle towards the humerus. the deltoid, attaching superiorly to the clavicle and scapula and inferiorly to the humerus. Work the anterior and lateral deltoid by using your thumb to glide down the muscle, ending at the attachment point on the humerus. Each stroke starts a little more lateral. Work all the way down the side, but always ending near its humeral attachment. Work all the way underneath onto the posterior deltoid. This technique can also be performed with your knuckles. This technique can also be performed with your fingertips. To work the posterior deltoid, sometimes it's easier if the client is prone, and again, you can use your knuckles, or you can use your thumbs. The supraspinatus, attaching medially to the scapula and lateral to the humerus. Find the spine of the scapula and then move anterior and use your thumb to glide laterally along the supraspinatus. You're working through the trapezius. Stop when you reach the spot where the acromion meets the spine of the scapula. You can also perform this technique with your elbow. To work the attachment point, place the client's hand behind their back. Follow the direction of the supraspinatus straight out to its attachment on the humerus, then use your thumb to apply pressure to the head of the humerus. The internal rotation of the humerus will cause the attachment point to move slightly anterior, so you may be pushing towards the ceiling. The infraspinatus, attaching medially to the scapula and laterally to the humerus. To work this muscle, use your thumb to glide up the medial edge of the muscle, then out towards the humerus. Stripping strokes can also be applied standing at the opposite side of the table, using your knuckles to glide laterally out the muscles. You can also use your fingertips for this technique. Another great option is to use your elbow, but be gentle. To perform compression, use your thumb to search through the muscle, pausing and holding on areas of tenderness. When the area has softened, move on to the next spot. Teres minor, attaching medially to the scapula and laterally to the humerus. To work this muscle, find the inferior angle of the scapula and use your thumbs to glide laterally out towards the humerus. Repeat this several times until the muscle has softened. The subscapularis, attaching medially to the anterior portion of the scapula and laterally to the humerus. To reach the subscapularis, take your fingers under the latissimus dorsi bundle, pointing towards the anterior aspect of the scapula. It can take some wiggling to get to the correct spot. Once you feel the bone contact your fingertips, move up and down along the muscle, covering as much as you can. Another way to perform this technique is to have the client sit with their arm around their bent knees and use your fingers to wrap around under the scapula to release the muscle. When you find the muscle, wait for a release to occur. Another option is to use your thumb to access this area. Always be aware of the brachial plexus that run near this muscle. You can also have your client sit normally and then access the muscle with your fingertips while standing beside them. Here you can see my finger position deep in the axilla. The edge of the scapula is here. To reach the inferior portion of the muscle, lift the shoulder with one hand and use your fingertips to get under the scapula. Some people won't be able to do this if their back is very tight. Another option for stripping the muscle is to apply pressure into the axilla with the fingers, while the other hand supports the scapula posteriorly. Find the scapula with the top hand and glide into the scapula, stopping to let the muscle release. The serratus anterior attaching inferiorly to the first 8 or 9 ribs and laterally to the scapula. To strip this muscle, position your client in side posture and use your thumb to glide towards the scapula. After the first pass, move superiorly and repeat. The straightest posterior inferior, attaching medially to the vertebral column and laterally to the last 4 ribs. To strip this muscle, use your fingertips to glide from the spine towards the ribs. You can also use your thumbs. You can also use your elbow. To apply compression, use your thumb to apply static pressure and wait for a release. To perform myofascial release to the chest and rib cage, have your client put their arms above their head and cross your hands over the lateral rib cage. Sink into the tissues, then let your hands slowly stretch apart. Be patient. Myofascial release work can take some time. Now move your hands medially and repeat. This is great for clients with restricted breathing. Now move your hands medially and repeat. Another option is to cross your hands over the client's chest and spread laterally. This is great for easing hunching shoulders. Follow the tissues as they unwind. Now move inferior and repeat. Be patient, relax, and breathe. Move inferior once again and repeat. Another option is to place your hand on the sternum. Apply pressure and let your hand slowly glide down the sternum. Let the motion be slow. Release when your palm reaches the bottom of the sternum. You can also use your thumb. Another option is to stand at the side of the body and glide your hand from the sternum and move laterally towards the shoulder. Glide slowly. After this is complete, move your hand inferiorly and repeat. To work the lateral aspect of the rib cage, position your client in side posture, arm overhead. Glide your palm superiorly towards the sternum. Next, start in the same position but glide superiorly towards the axilla. Let this work be slow and methodical. Finally, glide up even more posterior to complete your work on the rib cage. The diaphragm. Attaching anteriorly to the sternum, laterally to the ribs, and posterior to the lumbar vertebrae. With a client in side posture, use your thumbs to apply pressure under the rib cage into the diaphragm. As the client exhales, apply more pressure. You can also use your fingers with this technique. Serratus posterior superior. Attaching medially to the vertebrae and laterally to the ribs. To strip this muscle, bring your client's arm up and use your thumb to glide diagonally towards the scapula. If you find a tender spot, stop and hold and wait for a release. Repeat. The intercostals attaching to the ribs. To work these muscles, use your thumb to find the space between the ribs, then slowly glide laterally. Now follow the rib back and move superiorly to the next rib. Glide out. Move superiorly again and repeat. To stretch these muscles, have your client place their arm above their head. Cross your hands on the lateral rib cage. As they inhale, use your inferior hand to keep the rib cage stationary. As they exhale, stretch inferior while they stretch their arm even more. This is great for releasing the rib cage and enhancing breathing.